welcome to this health conversation from the Women's Health and Wellness Institute. I'm Tiffany Grunwald, so I'm the executive director of the Institute, which is, it's an amazingly innovative place at Providence Saint John's that is meant to meet all of the healthcare needs of women. So we have a very diverse group of physicians and care providers, and we are trying to put them not all under one roof because there is such a diverse mix, but through navigation and helping people to find all of our providers and resources, we are helping women access and get to meet all of their healthcare needs. So one of our big healthcare needs is physical therapy, and I'm a plastic surgeon and do a lot of breast surgery. And one of the things that every one of my patients does after surgery is go to physical therapy. And a lot of people think, oh, I don't really need it. And I feel it's such an integral part of becoming comfortable with the changes that your body goes through. And so in my world, that's post-surgical, but for a lot of us, it's aging or a sports injury or stepping off a curb and twisting your ankle. And so physical therapy, which is super broad, and we're going to hear about that tonight, is really important. And there's a lot of myths around it, which we will talk about tonight. We are very fortunate to have Diana Garrett, who is at Performance Physical Therapy at St. John's, and has certainly helped many of my patients and even me recover from injuries and surgery. So I think what we'll start with is welcome, Diana. So I think probably the place to start is, what is a physical therapist and kind of what training do you go through? And I just want to say right now, so all of these health conversations, which are just meant to be very casual and interactive, so you can put questions into the chat or on the Facebook Live, and Diana will get to them. But there are also all of the past health conversations, which span all kinds of topics. 2 weeks ago, we had Claudia San Miguel, who's a gastroenterologist, and she talked about SIBO and inflammatory bowel disease. In 2 weeks, we're having Kimberly Childers, who's a genetic counselor, talk about kind of that whole world, which is just, exploding as we find out things that will help us navigate our health and do more in the preventative space. But tonight, we're going to do physical therapy. So Diana, tell us kind of what a physical therapist is, and if there are different kinds, what your practice is, and what you kind of focus on and what your training was.
Yeah, well, thank you so much for having me. I'm so excited to be here and be part of this amazing group. I think the easiest way to think of a physical therapist is somebody who specializes in movement. So whether that's you're lacking movement because of a surgery, lacking movement because of pain, or just not moving very well, that's kind of what we focus on in physical therapy. So there's different degrees of physical therapy. Right now, most schools are a doctorate program. So someone will go through 4 years of undergraduate work and then apply to graduate programs in physical therapy and complete usually about 3 years to earn their doctorate. And that's when they can sit for their licensure in each individual state and be able to practice. There are some programs that you can continue to go on for more education. There are specific residencies that people can do in orthopedics or pediatrics or sports, to name a few, neurology. So physical therapy is starting to become more specialized, I think. People are starting to really hone in on kind of patient populations that they excel at, but most physical therapists are still very much general practitioners. We have board specialties in orthopedics, women's health, neurology, geriatrics, pediatrics, cardiopulmonary. Oncology is a new one that they just formed about 2 years ago, which was very exciting. Those are physical therapists that have gone through additional training, have experience and have taken an exam to show their proficiency in working with that specialized population. And so that makes them into kind of an elite, like about 4% of physical therapists are board certified into a specialty. There are additional things that you can do. There are fellowships to where you really hone in onto different things, like a fellowship in spine. I personally am in the middle of doing a fellowship in orthopedic manual therapy. So that is getting your hands on people and getting them to move well, and being able to kind of treat everybody as a whole. So there's always more and more happening and developing in physical therapy that are making people excellent clinicians and very skilled in different areas.
I had no idea that there were so many different specialties in physical therapy. I mean, I think it's great. And I wonder, when you call someplace to say, I need physical therapy, do you ask those questions? And do you say, like, are you a specialist? And what if there isn't one?
I think it's definitely helpful, at least I know in terms of our clinic, of if you call and you say, hey, like, I'm, experiencing back pain during my pregnancy. Do you have someone that specializes in obstetrics? Then they can kind of guide you and match you up with a therapist that might meet your needs a little bit more than others. I think it doesn't hurt to ask. You wouldn't take your Volvo into a shop that only does BMWs. You would want to find something that's going to fit you and your needs better. There are definitely lots of clinicians out there that are highly skilled in very general treatment. So, I am very lucky to see a lot of your patients. So technically, I would say I'm specialized in breast cancer rehab, but I'm also very skilled in doing orthopedics. I see a lot of post-operative. I see a lot of chronic back pain, neck pain from working from home. I just like to see how the body moves and trying to puzzle it together to figure out where is the dysfunction coming from and how can I help you get back to doing what you want to do.
I think that's the thing that's been really amazing as I watch you and different patients that you've seen, either mine or people I've referred to who have an orthopedic or a sports injury or something else, is that, I feel like physical therapists really know anatomy so well. And so you're kind of like, my shoulder hurts, and you go through this very specific process of trying to figure out why is that, right? So I think that's fascinating.
Yeah, I mean, physical therapists, if you think about it, are the only healthcare professionals that really study how the body moves, right? MDs are amazing at screening and making sure you got to rule out big, bad, ugly stuff that's going on. If you come in to a doctor saying, my shoulder hurt, they're going to be like, first of all, let's just make sure you're not having a heart attack. And then let's look to see if you don't have a fracture. Is everything in place? Is everything that's there? But then the physical therapist will take it a little bit further and go, okay, well, why are you having the pain? Why are you moving this way? Why are you trying to raise your arm like this instead of like this, which is causing you your pain, and kind of breaking it down a little bit further. And I think that's what makes physical therapy a little extra special, is like really trying to figure out the source and why do you want to move like that? What is making your body prefer to move that way versus another way that might be more efficient?
It is so true. And I think one of the things that I've really learned from you is that, when somebody has a shoulder injury or a knee injury or something hurts, the first thing is like, let me go see a surgeon. And you're right. They're going to rule out the big bad things. Like, do you need surgery? No, it's like, whatever. But then I feel like one of the things that you are really good at, and many of the other physical therapists that we use, is, your movement, right? And this is what you said, like, physical therapy is about movement. The way that you're doing something, the way you exercise or the way you sit or the way that you walk, there's something that we can fix there to make other muscles stronger. So it's more of a wellness approach, right? We're not like, as long as there's nothing bad, and we've kind of talked about that now, like, how do we make this work? Because this body's got to last you for another 50 years, right?
Exactly. It's, if you're not moving in the most efficient pattern, or if you're having compensatory movements, then odds are you're going to start to wear things down in other places. I actually saw someone today, brand new patient, had a total hip replacement on his left side. he's like, oh, I've been having this right knee pain. They said I have a torn meniscus and like my back's been hurting me. I'm like, well, that's probably because your arthritis was so bad and you delayed the surgery for so long that you couldn't get your knee towards your chest. You couldn't flex and bend your hip well enough. So even when you were sitting down, you couldn't really bend that leg enough. So you kind of sat askew. Now your back hurts. And then when you're walking, you're restricted in your motion. So you're hitting harder on the right side. And now you're wearing that down. So our body is so efficient and so adaptable that if something hurts, you're going to try to move around and maneuver differently, but that can create this kind of domino effect of things wearing down and breaking down over time. And so that's where physical therapy comes in, because we want to stop that cycle and kind of restore you back to what is a normal, efficient movement pattern for you. And for everybody, it's going to be different. If you have a neurologic disease that's occurring, like Parkinson's, you're not going to move the same way as somebody who doesn't have Parkinson's. So it's trying to figure out what's the best way for you to move as an individual to achieve your goals.
Yeah, and that's really the specialized, personalized approach. So I definitely want to talk about that. But first, you mentioned one of the specialties, or I don't remember if it was a board certification in physical therapy, but definitely one of the specialties was women's health. So because that's what we're all about, I would love to hear kind of what that encompasses.
Yeah, so women's health it is a board specialty, and there's a lot of subcategories underneath it. So one of the big areas is pelvic health. I am not a pelvic health specialist, but I know plenty of colleagues that are, and they are incredible at what they do, whether it's dealing with pelvic pain, either during pregnancy, postpartum, or just in general pelvic pain, sexual dysfunction, urinary incontinence, bowel incontinence. They do incredible work, and I would not do it justice of trying to tell you how they do it, but the clinicians that are specialized in the pelvic floor therapy, if you're having one of those problems, you want to see one of them, because they're going to be able to take it further than just a general physical therapist. Also part of women's health is obstetrics. So not dealing, but treating women who are currently pregnant or postpartum and some of the issues that they have. So I was actually listening to a little podcast before from an OB down in, I think, Houston. And she brought up a good point that we kind of normalize that pregnancy is painful and it's uncomfortable and just kind of deal with it. But it doesn't have to be. There are ways that physical therapy can help women move better. Your body changes and accommodates for a growing baby. And so that's going to change the way that a woman moves. As the baby gets larger, her center of mass actually shifts anterior, goes forward. So that's going to cause more demand on the back. And so there are things that we can do, whether using abdominal braces or SI belts, or specialized exercises, or looking at hip mechanics and making sure everything is moving well and can support that growing baby to minimize the strain on women.
Which is, I think, amazing. And even, some of the other things you were talking about, like bladder incontinence or even sexual dysfunction or pain during sex, like a lot of those things are internal and muscle related. And so part of that pelvic floor therapy, as I'm learning, is about strengthening different muscles so that you're not putting too much strain on one, right? Or you're relieving the strain. Is that right?
So I believe it's something like you have 12 muscles that line your pelvic floor, and it almost creates, I think of it as like a interwoven basket. And so if one of those muscles is kind of pulling in one direction, then it can have an effect on other muscles and kind of the structure and the function of what's going on. So a lot of the pelvic floor therapists that I know do some internal work, which has a huge effect on reaching those pelvic floor muscles more effectively than the external work.
Yeah, I mean, it's amazing to me. And again, like I've learned so much from you about this as you work with my patients. And, I'm operating on the breast, but they pull their shoulder in during recovery to protect everything. And then that impacts their back and their neck. And, all of those things are so intertwined. And you are trained to look at someone and say, okay, you need to fix this part of your posture, or we're going to work on strengthening this muscle.
Right. Trying to look to see everything kind of works together. So, when I look at the shoulder, it's not just the shoulder joint itself. So as your shoulder moves, you have to move at your acromioclavicular joint, your AC joint right here, your sternoclavicular joint where it meets your sternum and onto your axial skeleton. Your scapula, your shoulder blade actually has to move in order to stay underneath your humerus. So it kind of has this kind of following to where it needs to coordinate and make sure that you have good contact. Otherwise, you get this kind of impingement. But with that, there's 17 different muscles that attach to the shoulder blade itself. So if you have one of those muscles that's not doing the work that they're supposed to be doing, then that timing is completely off. And then to throw it in even further, as you get your arm all the way overhead, you actually have to extend and side bend in your upper thoracic spine. So it's all a matter of okay, where are you moving from? Where are you trying to move from? And where should you be moving from? And how is it all coordinating? A lot of times I find that my patients don't lack strength necessarily, but that their muscles aren't turning on in the right sequence to make them effective with getting their arm overhead or lifting a shopping bag onto their shoulder. It's not just going into is this strong and is this weak? It's are you using the right muscles at the right time to achieve the motion that you want to get?
That's interesting. So you're just watching their mechanics and then helping train those muscles to work in a certain sequence.
Yeah. I mean, I am in a heartbeat. What do you have on under that shirt? Do you mind taking it off? Can I see how you're moving? I got to see what is going on in order to make sure that I'm giving you the full treatment and addressing everything. Because if I don't, then you're going to have these compensatory movements and you might hurt something later down the line. And then I didn't do my job. And, my job as a physical therapist is to not see you again. I don't want to see my patients coming in for the same thing. I want them to be they're good. They have their homework. They're going to do their exercises and keep building and keep making sure that they're down that path of healing. And they don't have to come back and see me over and over and over again.
So, this kind of brings up one of our first myths, which is that physical therapy is only for sports injuries, right? And
right.
You and I both know that there are many times when someone should see a physical therapist. So let's talk about some of those, especially in the space of women's health. And if you haven't had a sports injury, but you have an ache and pain, do you call the physical therapist first? Do you go see your primary care doctor first? What is physical therapy outside of a sports injury?
Yeah, that's a great question. And I think it depends. So in California, we do have direct access to where you can go see a physical therapist before seeing your physician. Unfortunately, as a hospital outpatient facility, we don't have that rule. We do require you to see a physician first, which I like because I'd rather the physician roll out the big, bad, ugly stuff and then I can see you and just go to town and making sure that what's musculoskeletal going on. So if you're having some aches and pains that aren't going away and it keeps bothering you and it's limiting you in what you want to do, that's a great time to see a physical therapist. Or even if you don't have aches and pains, if you're just I really can't do this anymore. It's really hard for me to bend my knee up to paint my toenails, or it's getting harder for me to get put on pants and I kind of lose my balance a little bit. That's a great time to see a physical therapist before it becomes a bigger problem because it's easier to treat and you'll get better faster. I've had women literally come in, I don't know why I'm here. They just had surgery, but they feel great. They're look, I'm well, let's just see. Let's just see what's going on. I'm wow, look, don't have full motion on this side. You're moving a little bit funny this way. Can do some tests and measures to where I look at the mobility and look at the strength and kind of point out all of your faults, which is a great ego boost for me because I'm oh, look, I'm stronger than you. But it also gives me kind of a guidance of okay, we need to go down this road. And, someone might not realize that they're having issues because their body is compensating. They're no, I can still reach up. And I'm but your shoulder's in your ear. and you should be able to reach up without having to shrug it. But you subconsciously don't even realize that you're doing it until I force you to look in a mirror and be like, this side is different than this side, and that's a problem.
Yeah, that's fascinating because you're right. Like we kind of bowl through things, right? It's like, yeah, but I'm fine. I can do all of this. But the truth is, like, we want these bodies to work until we're in our late 90s. And so
Yeah.
to do that, you have to really be watching and noticing, and have good body awareness. And then especially to have somebody who knows what they're doing look at you and say, the shoulder's higher than the other one, or, you know, you're standing funny up with your hips or your knees.
And I think women are the worst at admitting that there's something wrong and going and seeking help. I think women are just, they're used to being so strong, like we just push through, just gonna keep going, just gonna keep going. I remember my mom having pain in kind of like her upper hip area. And my dad's like, you need to look at your mom. She keeps complaining. And I'm like, oh, Mom, what's going on? She goes, it's fine. It's just like a muscle strain. It's totally fine. I'm like, let me just take a look at it. Like I'm your daughter. You invested in me. Now it's time to pay back. And so, just trying to like look at it and encouraging her. I'm like, you know what? Maybe you should go to the doctor. She had 3 hernias. And I was
Wow.
like, this is a problem. But she just kept pushing through. She's a realtor and she's moving furniture, helping staging houses. And she's just like, I gotta do it. I gotta get this done. And I think women are like that, to where you just got to get it done. You got to take care of the kids. You got to do this. You got to go to work, and you just keep pushing through and kind of putting yourself on the back burner, when really these things are creeping along and can create bigger issues.
I think that's so true. Like there's definitely a resistance, you know, as I said, like every one of my patients has to go at 3 weeks, and they're like, you know, I don't really need it. Like, I'm fine. I'm doing everything I want to do. And sometimes I notice, but probably not as much as you would, like one shoulder's up or curled in, or, you know, something like that. And I wonder if there's resistance from primary care doctors. So if you go say like, my knee's hurting, and they check out the big things, and there's nothing wrong, you're fine, don't worry about it. What would a patient do at that point, since sometimes you need that referral? Can you help us kind of figure out how to do that?
Yeah, I think you need to be your own advocate. You have to know what your options are out there. You don't have to go straight to surgery. You don't have to go straight to pain medications. You can try alternative therapies. You can try conservative management with physical therapy. And sometimes you just have to flat out ask your doctor, "Can I have a referral?" I was lucky to see this one woman for a hip injury years ago, and then she got pregnant. And so she was having some issues during her pregnancy. She's like, "Can you treat me? Can you help me? You know my history, so I'd rather see you." And I said, "Yeah, let's work together. Let's figure it out." And she had a beautiful baby in January. And at her 6-week follow up, her OB was like, "Great, you look good." She goes, "No, I need physical therapy. I have pain. I want to make sure everything is moving well and I'm getting stronger, and I'm guided through the exercises of getting back to what I want to do." And so I think there's no shame in asking your physician for what you need. If you feel like you need physical therapy, or you want to try physical therapy before you take the next step doing something, it's not going to hurt you. I've seen plenty of patients to where they're like, "Oh, you could have surgery, but let's try PT first." And so we do PT, and either their symptoms get better and they're able to do more, or it's like, "You know what? There's not much I can do about this. Like, you're probably going to have the surgery. If you have this meniscus tear with a flap sticking up, I can't make the flap go down. But what I can do is make you stronger going into surgery, so your recovery afterwards is better and faster." And so physical therapy shouldn't hurt you. If it does, if it sets you back, then it's the wrong therapist and it's the wrong PT. But either it's going to make you stronger and make you more prepared for a surgery that you need to have anyways, or it's going to help you regain your function.
Yeah, so I think, and look, this is another myth, because you're like, maybe you have the wrong physical therapist. So people will say like, I'm going to go into physical therapy, and they're just going to do like massage and give me a hot pack. And why do I need to go in for that? Why do I need to give up like an hour and a half of my life to go do that? So what would you say to that when people are like, physical therapy is just massage, ultrasound, hot pack?
I would say that depends on the therapist. I think that's definitely more of like an old school way of treating in physical therapy. I think now we have the research and the understanding that people need more. You need more exercise guidance. You need more neuromuscular re-education, learning how to move your body in appropriate ways. I know a lot of patients ask like, oh, ultrasound. I heard that's great. Like, well, the research really doesn't show very much. Research shows that it reaches a maximum of 3 centimeters deep underneath the skin. So you're really not going to have that great of a physiological effect with ultrasound. So many therapists are moving away from the modalities like that. You know, a hot pack is only going to reach about the 3 centimeters also. Using
So three
tens or,
centimeters, meaning like it's not going to get deep enough to the muscle that's causing pain
yeah,
or is impacted.
exactly. So if I have somebody that has, you know, hip pain or piriformis pain, which is the muscle across your buttock that if it's really tight, it can impinge on the sciatic nerve and create those symptoms of sciatica. You know, I'm not going to do an ultrasound on that because I got to go through multiple layers in order to get to that muscle. So I'm really not going to have an effect. But what I can do is I can influence that muscle in different ways. I can help stretch it. I can do manual therapy to help kind of bring some blood flow to the area and get that muscle to relax. I can teach you how to use other muscles instead of your piriformis, using the rest of your gluteal muscles to give your piriformis a break and make you just move better and put less stress on that nerve. I think, you know, there are therapists that are more hands on and then therapists that are more kind of hands off exercise based. And some work great with certain patients and some work great with others. I'm definitely more of a hands on. That's where my comfort is. I like to get my hands on people and like feel things and facilitate movements and things like that. But there are definitely some patients that I'm like, you know what? Hands on is too much for you. Let's go do the exercises. Let's see if we can influence things on your own terms. Let put you in the driver's seat versus the passenger seat with me kind of moving you along.
That's awesome. Yeah, I mean, look, I think some of my knowledge is outdated too, because I still think like ultrasound, infrared, right? Like those were things that they thought, what did they think that those decreased inflammation?
Yeah, they kind of changed the blood flow to the area and increased this thermal effect. Now, there's definitely some research that's shown that ultrasound is great for like carpal tunnel syndrome or even getting a little bit into some scar tissue, but those are more superficial fibers if you think about it. They're not really having to go very deep. So
Right.
using a low level laser for those types of things also is really great. Um, I'm more like I want to get my hands in there. I want to influence that scar tissue. You know, if somebody's having scar tissue, the best thing for it is mechanical pressure. You can put cocoa butter, vitamin E oil, whatever fancy scar cream on it, but it's the actual act of putting your fingers on that scar and working that scar that's going to make it kind of soften and get smaller.
Because scar tissue, like ligaments and tendons, can continue to stretch, right, for your whole life. I
Right.
mean, they're always moldable.
Right. You know, we have this feeling, this research of an optimal golden period of 2 years for tissue remodeling. So the best time to get your scar tissue worked on is sooner rather than later, just because it responds better. But that doesn't mean that you can't have a response down the line because your tissues are constantly changing. It's just within those first 2 years, we see the biggest effects. So, you know, if somebody's a little apprehensive about coming into physical therapy immediately after surgery, it's not going to make or break your recovery. It just might make it a little bit longer.
That's interesting. And so the scar tissue comes when something's been there for a while, right? And so, I think one of the things that patients will say is like, I don't have pain, so I don't need physical therapy, right?
Right.
And sometimes when it gets to the painful part or something that's keeping you from doing something, you might not necessarily waited too long, but it would have been easier to fix before. Is that true?
Yeah, you know, it takes one element out of it. So the first thing that I do with patients is try to control their pain. You know, if somebody's coming in with an 8 out of 10 pain, I'm not going to get as much out of them because they don't want to move. They're apprehensive about it. So I need to calm down that pain first before I can really influence and facilitate movement. So if you come into physical therapy with less pain, it's going to make things move a lot faster. Like, oh, we can do this, this, and this, and I don't have to worry about irritating you so much because you're already at that kind of calm pain level?
So I guess there's two parts to that, because one is if it's post-surgical, then they're going to have pain, so they need to wait until they're done with pain. But then is that the same? Like if you, I don't know, like have a sports injury or something like that, and you've got pain. So in both of those instances, would you recommend people wait?
No. So I wouldn't.
I thought that's what you say.
I know. If you're having pain, definitely you want to address it, because if you think about it, if you've ever worn a shoe that's too tight that rubs on your foot and you get a blister, what do you start doing? You start walking differently. You try not to put pain or weight through that foot, and you start to hobble along. Well, if you keep hobbling, eventually something else is going to start to hurt. So address the pain first. Get out of the shoe, calm down the blister, change the pain level, and then you can go back into like, oh, let's work on this shoe and make sure it doesn't rub on that area again. And so this is the same thing with injuries. Like if somebody has a sprained ankle and they're in a lot of pain and then they're hobbling along, I'd rather get them in sooner. Let me see if I can decrease your pain, modulate it, control the inflammation, control the swelling, control your pain, and see if we can get more movement out of you so you can restore your gait mechanics faster. That way you don't have these long-term compensatory movements.
Which, the compensatory movements are just how you've been talking about how things are so related. If you have a blister, you're walking funny, and now you're affecting your knee and your hip and your back, and everything is so much related. So do you do work with people who just maybe they're the thing that they like to do is to hike, or they like to cycle, and something has just started hurting, and maybe that's because they're reaching a certain age when things just start to hurt. But is that a time to come in, or like where's that line about like, this is just a normal ache and pain, or maybe I should go see if like my mechanics are changing?
Yeah, I think if it's starting to affect you and, say that you can't hike as long or you can't spin for as long, it starts to hurt sooner. That's a great time to come see a physical therapist, because something is happening that's restricting your function. And that's what physical therapy is all about, is restoring movement and function and making sure that you're moving at your optimal way and being able to do all the things that you want to do. So instead of being, if you overtrain, we've all had those days where we worked out really hard and then we're really sore. You're like, okay, well, maybe that was too much. Maybe that was too much weight for me to lift. Maybe that was too long of a ride for me to go on. Let it calm down is what I would usually do. And then, cut back a little bit. And if you're still having that pain, then maybe it's something to do with your bike setup, or maybe something to do with your hip flexibility, or maybe your strength to get up that incline on the hike or down the incline needs to be enforced and increased. And so it's kind of a gray area, but I'm always like, if all else, just go see a physical therapist and make sure that everything is working optimally.
Yeah, I think, and I know both with patients and you participate in some of our breast cancer survivor group things, and people are always asking you like, my shoulder's hurting or my knee's hurting or my ankle, and sometimes it's just nice to be able to run that by someone and say like, am I doing this right? I stand up paddle, and there's all these clinics about how to get faster and win races, and I'm like, I don't really want that. I want to paddle for a really long time and not have an injury. I just want someone to tell me that my ergonomics are good in that.
Exactly.
So can you do that with different sports in your facility? Like if somebody's saying, I'm spinning and this hurts, can you recreate that for them?
Absolutely. So, we don't have a spin bike, but we have an upright bike. My favorite thing is I ask patients to have a family member, have a friend, take a video of them, but don't let them know when you're taking the video. So you don't try to do it correctly. It's just, let's just figure out what you normally like to do. For stand-up paddleboarding, we can't really recreate that in the clinic very well. Just lack of water. But having somebody take photos of you or videos of you so you can bring it in and be like, this is what I do. how can I do this better? How can I move better to make sure I can do this for longer? I am terrible when I'm out with friends because I'm always watching people. I watch people walk, I watch people ride their bike, running. I get too distracted. I can't run because I'm watching everybody else run and like, oh, that's going to hurt. Like that, they need some more hip mobility because that's going to wear down their knee. That's what physical therapists do. We analyze movement. So if we can't get you in the clinic, we can get you running in the clinic, biking in the clinic, or, I had somebody else that was like, I have problem picking up my grandchild. I'm like, okay, here's a 10-pound medicine ball. Please pick it up. Show me how you're picking up your grandchild, and we can kind of go from there. If not, I just have people take videos of them doing activities. My favorite is, people working from home, and they're like, and like, what's your computer setup like? They're like, well, it's kind of here and there. I'm like, you know what? Have your wife take a picture of you, but don't let her know that you want a picture at a certain time. She just needs to take a picture behind your back and just at different angles. And then I can look at it and be like, wow, look, when your computer's way down here, you're hunching over. So can we get that up? Just makes it a lot easier if I have some like video or photo evidence of what you're doing.
That's great. And I mean, as long as we're on this, there's a couple of other questions that are in it, which we'll definitely get to. But since you brought up the working from home, because many people are, even I am doing some meetings from home. Obviously, I can't operate from home, but we're kind of making the best of how we're setting up our computers and their laptops or their iPads. Sometimes they have a mouse, sometimes they don't, and I'm sure do you see that? Is it affecting people?
Yeah, so we are having an influx of work from home issues. I think, we are 1 year in from this and people are finally wearing down. Your body can compensate for so long, and then eventually it just goes, I give up. It's too much strain. I think at first people were like, oh, this is great working from home. I'm so excited. And then they get into this. Yeah. And now they're into this like, work from home. And like, some people invested in a desk and a setup because they thought, okay, this is for the long term. Let me get set up as much as I can, similar to what I'm at the office. And others are like, I'll just jerry rig it. I'll just, adapt to what it is. Ironically, I am sitting on the floor currently because I don't have a desk because I typically don't work from home. So I kind of rig my setup to where my laptop is on my coffee table. I have my couch behind me to kind of support my back. I'm sitting on a pillow to kind of elevate my hips and just in the most comfortable position for me, given my setup. And I think that is the best thing that people can do is try to get to as optimal position as possible with what you have. I think the hardest thing
is that optimal position? Let's talk about what are the elements of an optimal position?
So I like to work from the ground up because it's just easier for me to keep it organized. You want your feet flat on the floor, right below your knees. So you don't want to tuck them under. I'm short. I'm 5'2" on a good day. So at the clinic, if I'm sitting on a chair, my feet are dangling because I can't reach the floor. And so they're tucked underneath me. And that's really hard on the knees. And eventually it kind of just adds to the strain. So you want your feet flat on the floor, right below your knees. Your sitting angle, you want your knees to be slightly lower than your hips. So that kind of helps open up the hips. If you're really tall and you're sitting too low, what happens is your knees get too high, you flex more in your hips, your pelvis starts to rotate back, and then you start to flex in the bottom of your spine and kind of open up the bottom of your spine, which feels great as a stretch. But over time, the ligaments that go along the back of your spine creep into this lengthened position. And now those guys have all these nerve impulses in them and they can get painful. So you want your hips a little bit higher than your knees. You want some support in your back. This is where everyone kind of varies depending on how much support they need. Everyone asks me, like, do I need a lumbar pillow? I'm like, well, maybe, maybe not. It kind of depends on your spine and it depends on your chair. I like to think of it as we have a natural curve in our spine. We curve inwards at the bottom and then outwards at the top. I want to fill in that inward so that I don't have to flatten my back to lean back into my chair. I can just kind of fill in that spot and now I'm kind of propped up. If we keep going up, we want our shoulders directly above our hips. So we don't want to be leaning forward, because then you're straining your back. Your back muscles are having to kind of keep you upright. So we have our shoulders above our hips. And then ideally, this is where everyone goes haywire, our ears above our shoulders. Everyone loves to stick their head forward because they're looking at the screen that's a little too far away. My favorite thing is watching people drive. No one has their head against the headrest. I don't know why they have it there if they're not going to use it, but keeping those ears above the shoulders. And I like to have people tip their nose down ever so slightly. If I turn profile, which hopefully I can do this, what happens is people tend to come here and they think that their nose is straight ahead, but their eyes are actually upwards. If I try to get my ears above my shoulders and I tip ever so slightly my chin towards my Adam's apple, what happens is you can see that my eyes are now level. And that's the most important thing. If I come here, my eyes are already pointing upwards, and I need to get so that my eyes point straight ahead. So it's actually feeling like I'm tipping my chin ever so slightly towards my Adam's apple.
Interesting. So that's when you need someone to take a picture of you when you're on your
Exactly.
Zoom, Teams, whatever, work from home, all of those
exactly.
calls.
You know, and even just the angles of your elbows, you want them to be at 90 degrees or a little bit lower at your sides. And then we always talk about carpal tunnel. You don't want your wrists to be kind of extended this way. We want a nice neutral or a little bit bent to kind of let these tendons and nerves relax underneath here so that when you're typing, you're not stressing those guys out.
So all of those things seem very difficult if you have a laptop where the keyboard is attached to the screen. Because if everything's right up here, your hands are not going to be in the right place.
So the number one thing I tell people is get a wireless mouse. Just the trackpad, I think, is the worst invention ever, because now everyone's working from home and your shoulder, instead of being, let's see if I can do this. Instead of being my mouse right here, I have to bring it inwards, and you can see my shoulder just rolls forward. And now I've tightened up this pec muscle. And as soon as I roll my shoulder forward, my neck has to follow and my back starts to come in. So I see my brother all the time. I'm here. He's like doing his work. I'm like, can I just get you a mouse over here and just get that shoulder back?
That's because interesting. So the track or the wireless mouse, so that you can put it out here and keep your shoulder back and do it over there. I mean, I'm gonna have to go on Amazon tonight.
It's one small thing, but it's actually made a difference for a lot of my patients. You know, and there's different things. You know, if you're really using your computer for a long time, you can get different setups. You can get an extra monitor so that maybe you put the monitor up here, not up here, but up here, and then you can use your laptop as a keyboard, as like a docking station almost. But the most important thing is it really. This is a hard one, because a lot of research has been coming out of a debate as to whether posture actually influences neck and back pain. And in the PT world, it is a hot topic, and there are heated debates about whether or not posture actually causes back pain and neck pain. My personal stance is it does, but even more so, it depends on how much time you spend in that posture. If we weren't meant to move and slouch in this way, we wouldn't, is my feeling. That, you know, our body is meant to move and be mobile. And so when we sit at a computer for extended periods of times, it's not just the position you're in, it's the time you spend there. You know, optometrists will tell people, you know, to avoid eye strain, look away from your computer every 30 minutes. But the muscles that control your eyes are the same muscles in my pinky finger, in my back, in my big toe. They're all part of the same makeup of fibers. So if it's good for your eyes to move every 30 minutes, it should be good for your body to move every 30 minutes. I usually negotiate with my patients of an hour, because if you move every 30 minutes, you're not going to get anything done. So, you know, if I say set a timer
you have to stop every meeting.
Right. I'm like, set a timer, or every meeting you got to get up, get some water, and move. You know, and I've had patients that are like, I use a computer all day at work, even before COVID. I don't understand why I'm having issues now. I'm like, well, You probably had meetings, right? You went to the conference room, you went to this person's desk, you went to the printer, you went to grab water. But now in the era of Zoom, it's just one Zoom after another. You don't have to get up. You just end one meeting, you
Yeah,
go to another, and the
so
time just
true.
goes by and you don't even realize that for 4 hours you've been like, another Zoom, like, and not getting out of it and moving, to almost like reset those muscles. And it doesn't have to be you go and move for 5 minutes. It's just a, hey, get up, shrug it out, roll it out, get things moving, reset yourself so that you don't have this constant strain. Um, I had to explain it to my brother of, well, if you were doing bicep curls, you wouldn't hold a bicep curl for 30 minutes, would you? You probably get sore. It's the same thing of just
The
like
same
holding
thing.
those muscles in place for that long is going to create some strain on those muscles and create some pain.
Wow, that was just such great information. And it's funny because we didn't ever really think about it, but now so many of us are home and doing that. And just your little demonstration of posture and thinking about your eyes and your chin and where everything's going, and even the trackpad. I mean, you're totally right. Let me just get to a couple of these questions. So,
Sure.
recommendations on daily exercise to maintain muscle strength, and really like how important is muscle strength versus flexibility. I'm adding these, but it's just, like people think about different things. Some people are just for flexibility and some people think I just want my muscles to be strong. So can you talk a little bit about that?
Yeah. So the American Heart Association and the American College of Sports Medicine they recommended 30 minutes of moderate activity 5 days a week. Just for general health and general benefits of exercise, whether that's muscle or bone or flexibility or cardiovascular or mood or sleep. Exercise is the best thing that's that you can do, I think, in my opinion, of just getting moving. It doesn't have to be necessarily exercise, but physical activity of just getting and moving. Studies have shown that 2 days of inactivity leads to muscle loss. So, say you
Wow.
have surgery and you're in bed on bed rest, 2 days, you start to lose strength. So, the key is to keep moving. Um, Building strength, if you want to increase your strength, you got to do resistance training at least 3 times a week. I like to have, if somebody wants to do a general strength and conditioning program with me, which I've seen with post chemotherapy or even some post COVID, because that can wipe you out. I try to structure people's exercise routines a little differently, having them work like upper body one day and lower body the next day. So each day they're doing something, but they're not working the same muscle groups over and over to create fatigue of those muscles. They're kind of changing it up. The way that our body builds strength is to challenge it. And if you do the same thing over and over, you'll build some strength, but eventually you'll plateau and your body gets too efficient with it. It's like if you are a bike rider and you spin on your Peloton for an hour and then you go out to run and you're like, man, I made 5 minutes. It's just very different muscles. Your body's just not used to it. Your body became so efficient at riding the Peloton, it doesn't really know how to run anymore. So you have to kind of work on that. And I like to try to make my patients realize that they need to challenge themselves and do things differently each day so that they don't get too efficient and their body doesn't acclimate to that and they can keep challenging and build the strength.
That's great. And, it's in one of these conversations, we had Dr. Verna Porter talking about cognitive health and brain health, and it's the same thing. You just have to challenge it just a little bit. And so that kind of cross training, I guess, with your body or having different activities that you do is really good. What do you think about resistance bands?
I think they're great. I think they're a great portable piece of equipment. They don't take up much space. So if you have a small workout area, they're great. You can use them for legs and upper body, and there's different resistance strengths. So you can always build, to the next band color. Each brand has a different spectrum of colors. So I can't tell you which one's the hardest one because it depends on which brand you buy. But it's also great and adjustable that if you choke up on the band and make it more taut, then it has more resistance. So you have a little bit more flexibility with using bands. And I think you do of just having 5 pound weights. Although I love weights, I think they're great. I think resistance training is very important for women, not only for strength, but also for bone health. And I think it's something that women tend to shy away from because they don't want to get bulky. But it's really hard to get bulky. If you think about these professional weightlifters, they're having to increase their protein intake up to like 5 times, if not more. I can't remember the exact number, but they have to work really, really hard to build muscle bulk. So lifting 5-pound weights is going to be more beneficial for your bone health and your muscle health. And it's not really going to bulk you up in that manner.
Yeah, so the resistance and the bands are easy, but you also think that weight training is has a place as well.
Yeah, I think it definitely, studies have shown that resistance training really helps stimulate bone growth. Um, the very sad thing is our peak bone mass is in our 30s.
Oh,
When we reach the age of 40, we start to see bone loss. And it's a very sad concept to think of. And women are more susceptible to developing osteoporosis because of a multitude of reasons, but a lot of hormone reasons. And so I think resistance training is very important for women to start to think of in order to mitigate that bone loss. Studies have shown you can't really reverse the bone loss. You can't really build the bone back up, but at least you can slow the rate of loss so you can maintain these healthy bones throughout your lifespan.
so what are the top things that that help to maintain bone health? Like in my mind, I always think it's like running or like the impact things.
So you definitely want some impact because that helps stimulate the bone regeneration in your legs. So what happens is bone lays down more bone where it's stressed. It's called Wolff's Law. So if you look at like professional tennis players and you look at an x-ray of their forearms, if they're a right-handed tennis player, the bones of their forearm and their right arm will actually be thicker than the bones in their left because every time that racket hits the ball, it vibrates a little bit. Their muscles have to contract to kind of stabilize, and the bones have to respond to that new vibration and that new stress, and they lay down more bone to reinforce it. It's really cool to
Wow.
see somebody have
Yeah.
like x-ray side to side, and you're like, wow, that bone looks thicker than that one. And you're like, oh, are you right hand dominant? Like, yeah. Do you play tennis? Oh, yeah, I played tennis for 20 years. Like, that would be why. Um, so impact is important because that helps stimulate the bones. So the best exercise is walking for that. You don't have to run, but definitely walking. Unfortunately, doing the elliptical and bike riding is lower impact, so you're not going to get that stress on the bone quite as much. But it's still a great cardiovascular exercise, so you can integrate that in. For upper body, you got to get into the resistance, unless you want to walk around in a handstand. Then you can load through
Can't
the
do
upper
that.
body very well. But otherwise, you got to get the resistance going through resistance training, either the bands or the weights, something to kind of make those muscles contract. When the muscles contract, it pulls on the bone and it stresses the bone to reinforce it. So it's the same principle as impact, but getting the muscle contraction to reinforce the bone health.
Wow, super interesting. So, I during COVID and maybe it'll continue, I don't really know, but I certainly I know that some patients saw you by telehealth. I think there's also a big component out there. And sometimes when I send a patient to physical therapy, they'll say, oh, you know what, I have a personal trainer. They're just going to do it. I'm like, well, like the thing that I love when I send someone to a physical therapist is that you do the measurements so you can actually see if someone has their full range in their shoulder for me, or whatever it is that you're looking at. But can you talk a little bit about the difference between a personal trainer and a physical therapist, or even like an internet video?
Yeah, so I love personal trainers. I have friends that are personal trainers. I think not all of them are created equal, just like not all physical therapists are created equal, not all dentists are created equal, not all mechanics are created equal. You have your good ones, and then your ones that you're like, maybe I won't come again. The biggest difference between personal trainers and physical therapists is the education. A personal trainer is a certification. They have to go through testing, which certifies them as a personal trainer. But a physical therapist has to go through that upper graduate degree, and they go a little bit more into depth about the physiological changes that exercise has. And they have a little physical therapists work more in terms of, hey, I have an issue, I have an injury, and how can I work around it and make it still be able to do what I want to do without hurting it. Whereas a personal trainer, some of them have that background, but not all of them. So it really comes into like specifics as to what trainer are you working with? Do they feel comfortable working with whatever issue you have, whether it is post breast surgery or even just post total knee replacement? I have plenty of total knees that are like, oh, my personal trainer says I can never squat. I'm like, well, that's going to be really hard because that means you can never get up from a chair or off the toilet. Because technically you have to squat in order to do that. So let's try to rethink about what a squat is and how can we work into that. And I think that's just the different approaches between a physical therapist and a personal trainer is just, personal trainers going to be like, we're going to get you stronger. We're going to lift these weights and put them down and do those things. Whereas a physical therapist is going to tailor things more towards your functional activities of what do you have difficulties doing and what do you want to get better at doing, not only just in sport, but just day-to-day activities also.
I always love hearing you talk about things and your approach to the body and movement. And I think it's fantastic. And I can't believe the hour's already up, but it was, I learned so much. I mean, that was fantastic. And I've got comments both in the chat and on the Facebook Live that people really appreciated that. And I think this will probably get shared a lot, especially for when you're watching your spouse or your brother or your coworker sit at the computer like this. I think that was super helpful. I really appreciate your time and your expertise and the care that you take in assessing people's bodies.
Well, thank you so much for having me, and hopefully I answered a few questions and everyone feels more comfortable getting out and moving.
Absolutely. And we'll put the information for performance physical therapy on the Women's Health and Wellness Institute Facebook page so that if anybody is now ready to go get some advice, they'll know where to go.
Yeah.
All right. Thank you so much, Diana.
Thank you so much.
All right. Take care.
You too.
Have a good night, everyone.